Raymond. Empower your purpose.
Welcome. Thank you for listening in today. My name is Danielle Ambrosi, and I am joined today by Kurt Nurnberg. We are both healthcare business advisors here at Raymond, and we're really excited to bring this topic to you today. And I know that once we get started, you will all see Kurt's passion around this subject, and I'm looking forward to facilitating this conversation. So, Kurt, thank you for being here with me today.
My pleasure. Looking forward to it.
So, Kurt, as we approach the end of the year, so many of our clients are really feeling anxiety around managing increasing overhead, finding and retaining team members. If they can even find them, then they got to figure out how to retain them, and appropriately scheduling patients for restorative work and their next recall appointment. Is there anything that potentially addresses all these items?
You know, there's one common thread that I've used as a mechanism to speak about these types of things, and it's truly the impact of what your practice may have from participating with insurance companies. You know, it's all insurance in many practices is going to be a significant influence. The number of insurance companies and the fees and things like that that they reimburse for can really hurt, especially when you have the increased costs of labor, equipment, supplies, just overall, overhead management. And taking a look at access to care, as you mentioned earlier. A lot of practices actually have too many patients for what they can do, whether they're restricted because of hours, whether they're restricted because of unavailable team members being able to work. And then when you take a look at for practices that have enough team members, you look at adding an associate. Well, guess what? For some insurance companies, there's an impact or there's a negativity around trying to bring in associates from a standpoint of just overall operations and complications that it can be because of multiple layers of reimbursement for different provider statuses. And then lastly, the ability to stay current with technology is just something that continues to be an issue with these insurance companies.
Thanks, Kurt. That's great information. So what kind of recommendations do you make for a doctor who wants to entertain how their practice would look with less insurance influence in their office?
Yeah. The number one thing to look at would be identify your top 20 procedures and compare your fees to the reimbursement levels of each one of their carriers. And when you also identify which carriers you're going to compare, see if you can attach the number of patients for each one of those insurance carriers. That way you can see, if you make a decision to no longer participate or accept that reimbursement from that insurance company, does it affect 50 patients in your practice? Does it affect 200, 1,000? How many patients does that really have an impact on? And where this becomes very important is this. I have received many phone calls where clients will say, you know what, I got 3,000 patients. And when I ask them to really take a look at patients that have been in the last 12 to 18 months, that number comes down a lot to about 1,800 to 2,200 on a per provider basis. So it's extremely important for this joint analysis to happen, so that way you're making an informed decision and can have discussions going forward from there. Talk to your team about your thoughts, your ideas, and your vision. And the most important part, make it relatable to them. And one other avenue that I've used is every practitioner has some trusted patients in their practice. And I turn to them and I look for their feedback. Make sure they know that you'll continue to file the claims on their behalf. Make sure that they know that they'll be responsible for paying all of their money up front. Or if you decide, you can always have flexibility on accepting some payment now and some payment later or at the time of treatment. But that's the largest impact, is where patients are going to have more out of pocket on the front end. And even though they'll receive a payment directly from the insurance company, it might be 5 days, 7 days, maybe 2 weeks. That's going to be for a reduced amount too. So they're not going to have a dollar for dollar what they pay you for what they'll get reimbursed from the insurance company either.
So Kurt, you talked a little bit about kind of making it relatable to the staff members and kind of bring it in terms that they'll understand. Can you talk a little bit about how you would do that with the team?
Sure, that's, much like the doctors, the team members are so compassionate and they want to make sure that the patients are taken care of. In many cases, when I introduce this or have these communication meetings with practices and their teams, there's always one or two team members that say, we can't do that to our patients. We can't, we have to take their insurance. And in a lot of cases, I'll talk to that team member and I'll say, hey, I have a question for you. Would you be willing to work for this practice for the next 10 years and not receive a raise or not receive additional benefits? And at that point in time, that team member usually takes a look at me and says, why would I do that? And I say, my point exactly. So why should we be asking our doctors to do that same type of thing? And once you put it in that context, a lot of times the team members will be like, you know what? I never really thought about that. And so that's been a nice tool or vehicle that I've used to help bring team members on board with the vision and the ideas of the doctor.
It's a great example. So we talked about the patient experience and kind of informing them and getting them educated on the process. I know you've talked a little bit in the past about some, what's the word I'm looking for? In-house plans or reward systems to can you talk a little bit about that?
Sure. And that is a great point because some offices, the patients are automatically going to feel like you're taking something away from them. You're taking away the coverage. And so what they like to see is what are they going to get back for their loyalty on staying with you? So in a lot of cases with your insurance companies, you may be writing off 15%, 20%, 25%, or even in the case that you have the rented out networks, you might be writing off almost 50% of your fee. Patients don't know that, but when you run your own numbers and you can sit there and go, I can provide my patients even a 10% discount or bundled services for a prophy, x-ray, exam for a certain amount, and then having a certain consideration or a discount for restorative type work. And that's for the general dentistry. I mean, all this is applicable for many specialty practices as well. So I think the biggest thing is just, giving the patient something in return to where they feel like I'm getting some consideration for my loyalty.
Absolutely. So kind of what are the first steps to get started in this process? If you decide that this is something you want to pursue, what are your first steps that you would recommend a client taking?
The first item was that due diligence, kind of get it to where when you're talking with your patients, when you're talking with your team members, they're going to ask you, what type of work that you've done or, why you're making this decision. So when you can proactively say, hey, you know what, I've looked at these types of things and give them some idea of you just didn't wake up in the morning or just didn't go out on a Friday night and have these ideas, that these are well calculated ideas. That means a lot to them. So the due diligence is number one. Number two, write down your goals as the practice owner. Be clear and concise as far as why are you doing this? That's going to be your framework to really having a good sense of what the purpose is on why you're doing this. This is not for the faint of heart. There is going to be a financial impact. There is going to be an emotional impact. Some patients are going to be upset when you decide to do this. Some patients are going to leave. Others will just vent about you and your decision verbally in social media. So it's important to then extend it a little bit farther, create a Q&A, a question and answer form for patients. That way they can understand what it means from the standpoint of filing the claims to maybe some financial impact it may have on them. And along with that, you're also going to create a letter to your patients, okay? And this is all part of, I'm asking you to do this up front because this is going to help you put your mind around the importance of just, doing this whole thing. It is a it's a challenging endeavor, you know. And as you're finalizing your thoughts and ideas, start to create the tools and the scripting for team members so that they become equipped to manage these types of patient inquiries. And when you can show some of your team members already that you have tools, you have scripting, you'll do some role play as you're presenting it to your team members, they feel like, okay, yep, you have a plan and this is what's going to happen. This whole process will take about a year or more to put everything in place to make sure it's as effective as it possibly can be.
So Kurt, a practice decides to do this, they go through the due diligence, they start the process, they get their team informed, they get the patients informed. Draw us a picture of what a year later looks like for this practice.
You know, in a lot of cases, it's like riding a roller coaster, both emotionally and financially. The good news is your production's going to drop down. You're going to be sitting in your office at times, and you're going to have guilt. You're going to be like, oh my gosh, whoa, where are the patients? Where's this? Where's that? And you have to remember, this is part of the reason you're doing this. You had to slow down a little bit to get back into the love of dentistry, get back into taking care of people. And that all takes time. And at the same time, it's going to be a lot easier on your body. It shouldn't be hurting your neck. It's not going to be hurting your back. So getting through that anxiety of, change in life is very difficult.
So Kurt, thanks for this insightful information. I know there is so much for a practice to consider and to plan for in making a change like this. Like you said, it's an emotional roller coaster. It's going to take a while. It's a year-long process. Any last words of wisdom for a practice considering this change?
I've gone through this with, I'm going to say 18 to 20 practices. Almost everyone has the same words after the fact. Why didn't I do this earlier? At the same time, they'll say this was not easy. Okay. But from a standpoint of financially, over the course of a year, you got to give yourself a little bit of, build yourself up some buffers, because financially you're going to take a little bit of a dip. But at the end of 1 year, you'd be amazed at how many times when we sit there and we look at, okay, production's down. Well, your write-offs are definitely down, but your lab fees are down, your clinical supplies are down, and there's more things that are down. Even team members might be, the investment that you make for team members might actually be down, because when you were struggling to find that extra assistant or struggling to find that extra front desk or hygienist, you don't need them anymore. And so it also reduces the stress and things like that for your office as well, and for you.
Yeah, that's a great summary, Kurt. So I think basically what I'm hearing you say is you got to start somewhere. You got to start the due diligence, you got to start the process. It's not going to happen overnight, but if you don't start now, you're never going to get there. So got to start.
The most important thing, go through the analysis, feel good about it, talk to an expert in the field, get some advice, and talk to your team members. Your team members have to be on the same page, because your patients, ultimately, when this is announced to them, they're going to ask team members in your office, hey, how do you feel about this? And you need the team members to say, you know what, we feel really good. We put a lot of thought and effort into it. And for us to take the best care of you, we had to do this.
Great advice. Thanks, Kurt.
Thank you.